ഫ്രണ്ട്സ്, ഇന്ന് നമുക്ക് ഹെഡ് ഇഞ്ചുറിയെ കുറിച്ച് നോക്കാം. ഹെഡ് ഇഞ്ചുറി ഏതെല്ലാം രീതിയിലാണ് ഉണ്ടാകുന്നത്? ആക്സിഡൻസിലൂടെയും ശക്തമായി തലയിടിച്ച് വീഴുന്നതിലൂടെയും ഏതെങ്കിലും ഹെവി ഒബ്ജക്റ്റ് കൊണ്ട് തലയ്ക്ക് ശക്തമായി അടിയേൽക്കുകയും ചെയ്യുമ്പോഴാണ് ഹെഡ് ഇഞ്ചുറി ഉണ്ടാകുന്നത്. അപ്പോൾ നമുക്കതിൽ ഇമ്പോർട്ടൻറ്റ് പോയിന്റ്സ് മാത്രം നോക്കി പോകാം. Any injury that result in the trauma to the scalp, skull or brain is called as the head injury. And the cause for the head injury are the motor vehicle accidents, fall, assault, sports related injuries and firearm related injuries. Next one is the type. There are many different types of head injury. First one is the concussion, contusion, skull fracture and the hematoma. Concussion means it is a traumatic injury that affect the brain function. That means it is caused by blow to the head. അതായത് തലയ്ക്ക് അടി കിട്ടുമ്പോൾ or a violent shaking of the head and body. And coming to the signs and symptoms, headache, ringing in the ears, nausea, vomiting, fatigue, blurring vision. Okay, and if a witness is there, he may observe the signs and symptoms in the concussed person are temporary loss of consciousness, slurred speech, delayed response to questions and forgetfulness. Forgetfulness means nothing. That means the person he is asking the same questions repeatedly. Okay, next one is the contusion. Contusion means it is the bruise to the brain. Bruise എന്ന് പറയുമ്പോഴത്തേക്ക് ചതവ്, and it cause bleeding and swelling inside the brain. Okay, next one is the skull fracture. That means it is a break in a bone surrounding the brain. Okay, it can occur with or without brain damage, and the symptoms include pain, fluid leaking from the nose or ears, or bruise behind the ears or around the eyes. Next one is the hematoma. It is a collection of blood within the skull. That means the blood collection is within the brain tissue or underneath the skull. Next is the intracranial hemorrhage. Intracranial hemorrhage means it refers to acute bleeding inside the skull or brain. Next one is the intracranial hemorrhage. That means it refers to acute bleeding inside the skull or brain due to head injury. Okay, and it is divided into four: epidural hematoma, subdural hematoma, subarachnoid hemorrhage and intracerebral hemorrhage. Okay, epidural hematoma means it is a bleeding occurs between the outer membrane covering of the brain and the skull. And subdural hematoma means it occurs when a vein ruptures between the skull and the brain. Okay, it is life threatening and it usually results from a head injury. And subdural hematoma is divided into two: acute and chronic. In acute, it is caused by car accident, blow to the head and falling. And the most common symptoms include slurred speech, seizure, loss of consciousness, headache, vision problem, etc. And coming to the chronic subdural hematoma, it is caused by mild or repeated head injuries. That means these are common in older adults. That means who repeatedly fall and hit their head. And next one is the subarachnoid hemorrhage. That means it is the bleeding between the brain and the tissue that covers the brain. Next one is the intracerebral hemorrhage. That means it is bleeding inside the brain, and this is the most common type of ICH, and it occurs with a stroke. Okay, and the symptoms include headache, difficulty in speaking, nausea, confusion, drowsiness, seizure, coma, etc. And to prevent the ICH means wear helmet while riding a bike, always wear seat belt, and try to avoid falls in old age. Next one is the diagnostic evaluation. First one is the history collection. Second one is the physical examination, computerized tomography, magnetic resonance imaging, positron emission tomography, and X-ray. Medical management is the osmotic diuretic, anticonvulsant drugs, barbiturate, calcium channel blockers, etc. And the surgical management is the craniotomy, burr-hole craniectomy, cranioplasty, shunt procedure. Next is the complication. Okay, headache, loss of consciousness, numbness or weakness, unusual behavior, seizures or convulsion, loss of coordination, spinal fluid coming out from the ears or nose. Next is the nursing assessment. First one is the airway breathing circulation, GCS score, neurological examination, signs of elevated ICP, and signs of any CSF leakage. കുറച്ച് ക്വസ്റ്റ്യൻസ് നോക്കാം. ഡാഷ് is a head trauma that result in loss of consciousness for 5 minutes and there is no break in the skull. The answer is concussion. Dash is a collection of blood in the subdural space, that is subdural hematoma. Injury to the brain is particularly likely to cause death if it involves medulla. Subdural space is the space between the dura mater and the arachnoid mater. Okay, thank you.